today, first of all, I thank you to the to Dr. Bilal Hossain sir. He is doing his presentation and let's start.
আজকে আমি বিশেষভাবে হ্যাপি। বসো,
একদম সামনে।
আজকে আমি বিশেষভাবে হ্যাপি কেননা আমাদের সঙ্গে তপন গড়া এসেছে। তখন আমার একদম ছোট ভাই, মানে আমি যখন এমডি করছি, আমি যখন হাউসটা, ও তখন ইন্টার্ন, আমি যখন এমডি করছি, ও তখন হাউসটা। হি ইজ ফ্রম বালিচক। দীঘা কাঁথিটাকে তো বোধহয় কিনে ফেলেছে সম্ভবত। দীঘাতে 100টার বেশি পেশেন্ট থাকে। যাই হোক, তখনের গল্প শেষ হলে আমার গল্প শুরু। কোলাঘাট ইজ মাই ভিলেজ অ্যান্ড কলকাতা ইজ মাই সিটি। Today's topic of discussion: ferrous ascorbate versus other ferrous iron salts. Every second Indian woman has anemia. That means 50% of Indian women have anemia. And very funny thing is that recent girls, they have the highest record, 59%. Followed by reproductive age 57, pregnant women 52, and lactating mothers 58%. They suffer from iron deficiency anemia. It is losing the metal, that is the iron. According to WHO, the definition of anemia is less than 11 gram per DL of hemoglobin. IDA is the most common cause of anemia during pregnancy. IDA during pregnancy is a serious issue around the world. In developed countries it is 40%, and in developing countries it is 56%. Pathophysiology of iron deficiency and iron deficiency anemia in pregnancy. It is due to dilution effect of blood, where the blood volume increases by 50% and RBC volume increases by 25%. And because of the placental development and also because of the fetal requirement, there is iron deficiency anemia. Iron requirement is 9 times higher during pregnancy. There is a calculation of demand versus supply. I am not going to the details. Diagnosis of iron deficiency anemia. The first diagnosis is your hemoglobin concentration measurement. Everybody, all of us know the percentage of hemoglobin defines the level of anemia. I will tell you some newer words also. Newer information. Iron specific biomarkers help distinguish iron deficiency anemia. One of them is serum ferritin and other is transferrin, that is T-SAT, and the newer one is hepcidin. I will tell you just later on what is hepcidin. Newer blood cell parameters for specifically for iron deficiency anemia. These are advanced red blood cell and reticulocyte index. It is called hyporeticulocyte or CHR or MH. These are measured by modern automated analyzers. Advanced red blood cell and reticulocyte indices are indices such as percentage hypochromic reticulocyte or reticulocyte hemoglobin content and the percentage circulating microcytes are established markers of iron deficient erythropoiesis. iron deficient erythropoiesis and are measurable with modern automated analyzers. What is hepcidin? Hepcidin is a hormone that regulates iron in the body, and its level can be used to diagnose and manage iron disorders. I'm just going back to some one on the slide. Hepcidin, here is a line, inversely proportional to iron therapy requirement. Here the line is written, inversely proportional to iron therapy requirement. Now coming to this slide, hepcidin is a hormone that regulates iron in the body, and its level can be used to diagnose and manage the iron disorders. Hepcidin deficiency can cause iron overload. That means hepcidin up means iron is low, and hepcidin low means iron level is up. That's why I call its reverse. Total iron requirement in pregnancy. The average daily requirement of iron is calculated at 0.8 milligram per 100 ml in the first trimester and increases to 7.5 milligram per day in the third trimester. The average daily absorption from Western diet, it supplies 1.5 milligram per day, and in Indian diet it supplies 0.8 to 4.5 milligram per day. Total iron requirement during singleton pregnancy is 1000 to 1200 milligram. Oral iron therapy. Dependent on the type of preparation, only 1 to 8% of iron is absorbed from the available oral iron preparations. The absorption of oral iron increases with increasing doses of oral iron only up to 160 milligram per day. All pregnant women should be instructed to take oral iron either in empty stomach or 1 hour after meal, and for better absorption, preferably with vitamin C and the fruit juice like orange juice or guava juice. Iron supplementation in pregnancy, WHO recommendation for prophylaxis, it is 30 to 60 milligram elemental iron and 400 microgram of folic acid, and for treatment purpose it is 120 milligram. It will be up to 120 milligram. Hemoglobin concentration rises to, here this is 110 gram per liter, that means 1 gram per DL. Prophylaxis. After achieving the for Foxy recommendation, after achieving the normalization of hemoglobin, a prophylactic daily dose is 60 to 100 milligram of iron. This has changed later on. I will tell you this has changed later on. Treatment in pregnant women with established mild to moderate anemia with a period of gestation of 30 to 32 weeks, and those who respond to a trial of oral iron, the treatment should continue with 100 mg elemental iron twice daily and 500 microgram of folic acid. The dose has changed. Anaemia Mukta Bharat in 2009. Daily 1 iron and folic acid tablet starting from the 4th month of pregnancy, continued throughout pregnancy, and to be continued for 180 days postpartum. Each tablet containing 60 milligram of elemental iron, not 100, and 500 microgram of folic acid. This is for prophylaxis. And for treatment, the Anaemia Mukta Bharat 2019 policy, there is 2 tablets of iron and folic acid tablet. That means 160 milligram of elemental iron and 500 microgram of folic acid per day. If the iron dose exceeds 160 milligram, it does not absorb. Supplementation intervention by Ministry of Health and Family Welfare for children 0 to 5 years, 20 milligram of elemental iron and 100 microgram of folic acid per ml of liquid. For children 6 to 10 years, it is just 30 milligram of elemental iron and 250 microgram of folic acid per child per day for 100 days. For adolescent there is a weekly dose. 100 milligram elemental iron and 500 microgram of folic acid with biannual deworming. And our adolescent anemia rate is 59%. And for pregnancy and lactating women, 100 milligram of elemental iron and 500 microgram of folic acid daily for 100 days during pregnancy, followed by the same dose for 100 days in the postpartum period. This has become 180 days, this has become throughout whole pregnancy, and this has become 60 milligram, this has become 500 milligram.
মানে স্যার এগুলো চেঞ্জ হয়েছে তাই গাইডলাইন
এটা একটু পাল্টেছে। ওরাল আয়রন, ফেরাস অ্যান্ড ফেরিক, ফেরাস অ্যাসকর্বেট, ফেরাস ভিউমারেট, ফেরাস সালফেট, ফেরাস বিসগ্লাইসিনেট, and ferric iron polymolecular complex and ferric ammonium citrate. Somehow ferrous molecule is better for absorption purpose. Comparison of different doses of daily iron supplementation for anemia prophylaxis in pregnancy. A systematic review. Who recommended a dose of 30 to 60 milligram elemental iron for prophylaxis in pregnancy? India followed 100 milligram of iron for anemia prophylaxis, which recently revised to 60 milligram. In global studies, prophylactic dose of 30 milligram and above has shown maintain normal hemoglobin. Studies from India, prophylactic dose of 120 milligram showed consistent result and 60 milligram showed inconsistent result, though this has not yet been recommended by Ministry of Family and Health. No significant difference in side effects up to 80 milligram of iron in global studies, and side effects were comparable with 60 to 240 milligram doses in Indian studies. Oral iron prophylaxis in pregnancy, not too little and not too much. This is the catch line. Regarding the elemental iron molecules, it is very much clear that ferrous ascorbate has the highest absorption rate, 67%. The other molecules fail to reach the level of ferrous ascorbate. They are very poor absorption rate, all the molecules. Challenge with conventional oral salts. Effectiveness of many oral formulations may be reduced by limited bioavailability, particularly in patients with underlying inflammatory conditions. Only 10 to 20% iron from oral ferrous formulation is estimated to be absorbed. What about the unabsorbed portion? The unabsorbed iron can form reactive hydroxyl radicals in the gut, leading to mucosal irritation or damage, resulting gastrointestinal adverse events such as nausea, epigastric discomfort, and constipation. Unabsorbed iron may also affect the gut microbiome and can trigger diseases like IBS. Ferrous ascorbate is a synthetic chelated form of iron in the ferrous state with ascorbic acid. Ferrous ascorbate is known to remain soluble in alkaline pH of duodenum, small intestine, which is an advantage over the ferrous salt in the iron supplementation. Absorption from ferrous ascorbate is much higher because the explanation is later. There is an explanation. Ferrous ascorbate is a synthetic chelate of iron in the ferrous state with ascorbic acid. Higher absorption of iron from ferrous ascorbate can be explained by the ascorbate component that prevents oxidation of iron to ferric state. Right ratio for a molecule of ferrous ascorbate, iron and ascorbic acid, they have a standard ratio 1:6.3. If this is not maintained, the coating of intestine might get damaged. Clinical evidence. Study of ferrous ascorbate, tried study. Result is significantly more patients became non-anemic by treatment with ferrous ascorbate than with carbonyl iron. Ferrous ascorbate replenished ferritin stored to a greater extent than carbonyl iron. Hemoglobin increase of 5 gram per dl versus 2.8 gram per dl in 60 days. Compare ascorbate versus carbonyl. Pride study rapid rise in hemoglobin by 5.03 within 60 days. This is another trial, horse trial. The result shows that a dose of 1 tablet daily was effective in treating anemia with rapid increase in hemoglobin within 45 days and was well tolerated. The maximum increase of 3.60 gram per dl was observed in those with baseline hemoglobin less than 6 gram per dl. Comparison of various oral iron salts in treatment of iron deficiency anemia in pregnancy. Maximum rise in hemoglobin on day 60 was with ferrous ascorbate and minimum rise with ferrous sulfate. Comparative study of different oral iron proportions in gynecological and postnatal patients. On intergroup comparison, maximum rise in hemoglobin on day 90 was with tablet ferrous ascorbate. Key attributes and benefits of ferrous ascorbate. Ferrous ascorbate has a better bioavailability as high as 65% and utilization of iron when compared to other preparations. Ferrous ascorbate is a stable chelate that does not dissociate in the gastrointestinal tract. A mean rise in hemoglobin greater than 5 gram per dl in 60 days and greater than 2 gram per dl within 45 days is reported with once daily therapy. The slide has ended, and I sincerely thank Comrade for Society, and I request you, these members, to come early if you are called.
One question. You prefer deworming during pregnancy? If you prefer, then in which trimester?
In which iron therapy?
No, deworming in pregnancy.
Government policy and our own policy is different, I think.
Yes.
Because they randomly give the albendazole, but albendazole is questionable deworming drug in pregnancy. Parental permit is better than albendazole. Albendazole is steroidic.
The deworming drug albendazole should not be taken during any stage of pregnancy. It may cause harm to the fetus.
I will advise deworming after 20 weeks, not before that. Honestly, আমি কি ঠিক বললাম?
I also prefer that, and that is why I asked the question that whole public is also preferring that or not.
Probably the comparative study between albendazole harmless and the anemia harmless. They have compared the anemia is more harmful. That's why they are taking albendazole.
Is routine deworming at all necessary? এটা তো
Yeah,
আমার কোশ্চেনটা
yeah.
ছিল। কোশ্চেনটা হচ্ছে is
Not-
routine deworming at all necessary?
Routine deworming.
Our country maybe because adolescent anemia একটা কারণের মধ্যেই দিয়ে দিয়েছে যে
Helminthic infection.
one infestation। কাজে adolescent anemia কে আমাকে যদি মানে কারেকশন করতে হয় আর ডিওয়ার্মিং তো করতেই হবে। So why not in pregnancy? সেই হিসেবে অ্যাডভাইস করা যায়, দেওয়া যেতে পারে, এভরিথিং ইজ রাইট, কিন্তু আই অবজেক্ট আলবেন্ডাজল।
কি ড্রাগ দেওয়া উচিত?
বায়োন্টার পামেড, বায়োন্টার পামেড একদম তোমার স্বীকৃত ড্রাগ। থ্যাংক ইউ এভরিবডি।
থ্যাংক ইউ, থ্যাংক ইউ।
থ্যাংক ইউ।
Excellent presentation. Next.